Orlando Health is home to the only accredited spinal cord injury program in Central Florida. That's right, it's right here in our backyard. And we are so fortunate today to be joined by Brittany Rohan, who is a neurological physical therapist here at the Orlando Health Advanced Rehabilitation Institute. Thanks for being here, Brittany.
Thank you for having me.
You have some of the most cutting-edge technology that's available right here to treat spinal cord injuries. Tell me a little bit about what you're working with.
Yes, so we are very fortunate. We have a few ZeroG systems. We are actually the first in Florida to have this piece of technology, and that is really great. It has a body weight support system, so we can use body weight support if we need to off-weight our patients a little bit. If not, we can just use it as a harness system for someone walking. But it really allows that patient to get in high reps of stepping, which is really important, especially for incomplete spinal cord injuries, to build that neuroplasticity. So that's basically creating the pathways between your brain and your spinal cord to get your legs moving again.
What are the results that you're seeing with this technology versus the way that you did it in the past?
So a part of having this equipment is that we can now do forwards walking, backwards walking. We're really pushing the speed, the incline. So before, if we were just walking someone with a walker kind of casually, you're not getting the same results and the high intensity. And it also allows us to do a lot more because we have the harness system to safely be able to do more dynamic activities. We can use weights, we can use different obstacles that they can step over so that we're targeting that high intensity gait training as well.
Joining us now is Corey Quigley, who is the spinal cord clinical specialist here. You're an occupational therapist, and your role is a little bit different here. Tell me about what you do.
So one of the things we use is a machine called the Xcite, and it's a portable neuromuscular functional electrical stimulation machine. So what that means is it can send signals down to the muscles, and we can target the muscles in certain movement patterns to try to get the brain to relearn how to move those limbs.
So you are an occupational therapist, as we said, and it's different than physical therapy. How is it different?
Yeah, so that's a great question. We work on very similar things. We work on strengthening movement, but what occupational therapy tries to do is to apply it to an activity they do on a daily basis. So something functional, whether it's how am I going to get in the shower again, how am I going to get dressed or take care of myself or my loved ones, we apply that rehab to something that's important to that person. For example, yesterday we had somebody come visit. He went home in a wheelchair and needed a lot of help from his loved one, and he walked up to the front desk with a cane. And so that moment is like, I didn't know if that would happen. So I'm very fortunate. This program is amazing. You see incredible things, and sometimes, that's just what makes us so special.
It's another reason to choose well with Orlando Health. And if you would like more information, you can visit orlandohealth.com/advanced rehabilitation.